African National AIDS Council launched a 5-year LGBTI HIV plan that is tailor-made to address the challenges this community faces with regards to HIV, TB as well as STIs. This 5-year plan was launched at this year's SA AIDS conference at the Durban Inkosi Luthuli International Convention Center last week. The plan, on the other hand, also supports the recently launched National Strategic Plan for HIV, TB and STIs for the period of 2017 to 2022. Joining us from our studios in Pretoria this morning is Letsike, the Deputy Chairperson. Good morning to you and thank you so much for coming through.
Thank you so much. Good morning to yourself and to the viewers.
Now tell us more about this 5-year plan as to what it entails.
First, I think we need to acknowledge South African National AIDS Conference have launched the NSP in March by the Deputy President, who's the chair of SANAC. As part of that, there was a commitment by SANAC that we want to respond to the needs of people who are left behind, and particularly LGBTI people and many other key populations that are highlighted in the plan. So this plan that is first of its kind, the LGBTI HIV plan, it's really about addressing the needs of LGBTI people in South Africa, particularly to reduce the new infection, to ensure that LGBTI people have access to treatment and to broader services. And part of it is really around how we integrate programming in a meaningful way at service level.
Now, the concerns really, what are the main concerns, Mapaseka, in the LGBTI community, more so with regards to HIV, TB as well as STIs?
Yeah, I think for a very long time and so many aching years, LGBTI people have been discriminated, have been stigmatized, have been rejected and denied health services. And with that reaction of discrimination and stigma, LGBTI people have delayed seeking health services because of fear of being discriminated. And we've seen the research in 2004, we already knew that 12% of people, of LGBTI people were rejected. And again, 6% then delayed seeking health services. And not only at health, but you're also talking about services in school, services at police station, where we're also seeing gender-based violence and hate crimes targeted at LGBTI people. So we've seen significant loss and lack of interaction from that community because of stigma and discrimination, and which is then contradicting what the Constitution says. Yeah,
as you said yourself, that the issue of stigma and discriminations, it's not necessarily a new phenomenon. It has always been there over the years. But this plan, how is the plan going to, address those challenges of stigma and discrimination against the LGBTI?
I think the most important thing about this plan, and that we're seeing, it's a peer-led navigation approach, where we're then saying every government department should integrate LGBTI programming. So if you're talking about addressing health services, you've got sensitization training that all the health facilities and health workers will be trained around sensitivity, but also will be competent to deal with clinical issues and also sensitization. But you're also talking about issues of ensuring care and commodities that also should be reaching LGBTI people are in place. And you're talking about addressing the legal environment, so you're talking about transgender population, where we've seen constantly that they have not been integrated. So this plan, ultimately, we're saying we want to reduce new HIV infection and TB and STI, and LGBTI is part of it. But we also want to empower LGBTI people to know their rights, to understand their role and contribution onto the socio-economic and political environment. But part of it is to then reduce the vulnerability biologically, socially, and structurally that puts LGBTI people at risk.
Yeah, and I think the main question here is this plan really realistic and tangible? Because we continue to see the brutal attacks on the LGBTI communities. There's a recent case in Kroonstad whereby a lesbian was killed and burned. So is it really a realistic plan and a tangible one, so to say?
I think as a country we need to be ambitious, but we also need to recognize what needs to be done. We've had for a very long time a constitution that has not been realized by LGBTI people because we have not integrated programs that addresses the needs of LGBTI people. Now, yes, this plan, we might say it's not realistic. Yes, we might say this plan is realistic. I am very much optimistic because of this plan. It's actually saying that we want programs that are government integrated, that every service provider, including NGOs, development partners, can say this is the contribution we want to make. I again say, South Africa, yes, it's a violent country, and we've seen high rates of gender-based violence. We've seen high rates of hate crimes, which is very problematic. Now, it costs 15 billion if the country does not reduce or prevent gender-based violence. But similarly, it costs the country so much money if we don't prevent hate crimes. Now, it is about how do we hold government accountable according to the programs that they have launched. We have waited so long, 10 years, to have such a plan within HIV programming. Now it's time to act. Now it's time to hold government to account. Now it's all stakeholders to come and contribute to the needs of LGBTI people. So there are targets. Yeah. They are realistic to saying these are contributions that can be achieved annually. By 2022, which is aligned to the National Strategic Plan, we can measure and say, have we reached LGBTI community and at what level, and what is the progress thus far? And
I believe so far we just need to be optimistic that everything will go accordingly. But I just wanted to put through to you just one more question before we wrap up. The issue of the difficulties. Do you think that the LGBTI community come across difficulties in accessing treatment because of discrimination and the stigma that we know that they face all the time?
I mean, it's not only LGBTI people that faces challenges. I think general population as well. I think what we then saying, we want when LGBTI people, like many other persons in communities, when they go to the community center or primary health care center or even hospital for that matter, they must be treated equally. It's not about somebody's gay, somebody's transgender or lesbian. It's about serving a person. What we want healthcare workers to ensure that they are competent, not just friendly towards LGBTI people, but competent to design prevention issues, but also to ensure that treatment is accessible. Currently, the Minister of Health is implementing what we call universal test and treat. But ultimately, we need targets that also speak to LGBTI community than just the general population, because LGBTI people have been left behind.
Yeah. We'll leave it at that for now, but thank you so much for talking to us.
Thank you so much.
Thank you very much. There you have it. That is Letsike, the Deputy Chairperson, talking to us about the South African National AIDS Council launching a 5-year LGBTI HIV plan that has been tailor-made to address the challenges that they face in terms of accessing treatment. Well, let's take a break.